Hey, what's up guys? Abhijit Minas here. I wanted to make a short video on a topic that I've had a lot of physios ask me questions about, and I've also seen a lot of patients come to see me with low extremity issues like hip, knee, or ankle issues, where they've tried the traditional, and what I mean by traditional is like just physiotherapy for the joints and have not felt so good. And they've come in to see me for a second opinion, and I've often found that there was not a whole lot wrong going on with their hip, knee, or ankle. So I find like maybe the previous practitioners were probably trying to chase symptoms or just work on that particular side. So I want to talk a little bit about looking the body as a whole and not being too microscopic. So to give you a few examples, in the last couple of weeks, I've had some patients come in with ankle pain, chronic ankle pain. I've had like inversion ankle sprain patients. I've had patients with oral surgeries and distal fibular fracture surgeries, and have now been having pain for in the ankle for a couple of months now. I've also had some patients with knee pain, and they've tried like I said, the regular like just conservative physio with like stretching, strengthening, manual therapy, exercise, joint mobs, all for the local joints, and it hasn't helped them a lot. So just want to talk a little about if you find such patients and it's really frustrating and you're not getting best results just by working on the joints, here are some ideas you could probably use. So I see a lot of patients based on the MDT method or the McKenzie method, and I got to say that a lot of times when anybody comes in and complain of like ankle pain, knee pain, any kind of lower extremity pain, even like hip pain, I am always screening for low back according to the MDT classification, or just the MDT movement sequencing. I'm always doing that, and I often find I have a few testimonials. I have one right now where I'll show you how one of my patients got better by doing back stuff that made his knee and his ankle better. So first of all, let's talk about what can you find in history, right? So to give you an example, I've had some patients with knee issues who've come and complained of pain in the knee. Could be on the medial aspect, lateral, but the biggest thing I found is they've not had pain with, if my patients during the history, if they say I don't have pain with stairs or walking or running or any kind of activity that requires lower extremity or your knees to being used, and they get random pain just when they're sitting for too long and their knee starts to hurt, or probably when they're sleeping at night and their knee starts to hurt. All these kind of symptoms make me think that this may not be a true joint issue, because when you're sleeping, you're basically not using a whole lot of your legs, right? So why would your knee hurt otherwise? I think more joint-wise, if somebody said, you know what, every time I go down the stairs or every time I go up the stairs, that's the only time that it hurts, or when I squat, that's the only time, that's when I might think a little bit more towards the joint, though I still screen the back. But oftentimes history where somebody says that they had no history of trauma or injury, they've never like hurt their ankle, but they still feel this kind of radiating pain, or they won't even say radiating, it doesn't have to be, just pain in the ankle. And oftentimes they might describe these pains as moving pains. So to give you a classic example, my patients with knee issues, but with no history of any other like knee factors, they often say that they have pain, say on the medial or the lateral aspect of the knee, or sometimes like up the ITB, and you know, so it moves around a little bit. For my ankle patients, even though they have had history of fractures and traumas, and it's been 8 or 9 months, and they still have pain, even with chronic ankle sprain, they still have pain. However, as we know, go back again, there's so many examples, but to go back to the patient that I saw, I had one patient who had chronic inversion ankle sprain 8 months ago, and she's been having pain ever since. She reported something really interesting. What she told me was that she was getting ankle pain not just on the on the lateral aspect of the ankle, close to the ATFL and CFL and all those areas, but she'd often complain of pain like on top of her foot, so some kind of tingling, and sometimes it will even shoot up here. Now, these do not, to me at least, sound like pure ankle issues, because a lot of times with a pure ankle sprain, you'll feel like the patient complains of pain mostly with movement. So if they're trying to get into, say, plantar flexion or inversion, those kind of movements repeatedly would cause pain. So every time you do those motions, that seems more like a classic ankle sprain. So, but pain at rest, pain when they're not doing anything, makes me think about back, or just making them go through the McKenzie thing. Same thing for the knee. If you feel like they have tingling numbness or radiating pain up or down the leg, and if you're only treating the knee, you might be missing something here. So you want to make sure that you go through the whole derangement classification and find of the MDT method and look for a directional preference, right? So use that directional preference and see if that changes the symptoms. So for a lot of my, some of the examples that I was giving you for my patients with knee and ankle issues, I haven't touched their knees and ankles because the previous physio had done all that. So what I focused on was, again, the back assessment, side glides, back extension, forward flexion, to see if those symptoms increase the pain or decrease it, or if there's any limitation, and then I kind of work on that. And in fact, hopefully I'll be able to add more testimonials later, but I have one testimonial now where my patients, I haven't touched their knee or their ankle at all, and only worked on their lower back with certain motions, and that has significantly decreased their symptoms. So the take-home message here is that if somebody comes in with ankle issue or knee issue and you're only just microscopically looking at those joints, but if your history also has some of the stuff that we discussed in this video involved, think in that direction as well, especially if you have tried everything, like you've tried your special tests, you've tried like all your palpations and range of motion is good and there seems to be nothing wrong, but they still complain of pain. There could be high chances that this pain could be coming from somewhere else. So hopefully that tip helps. Keep following my page, Abhijit Minhas PT, for more physio-related stuff. Signing off. Bye. Here. Hey guys, Abhijit Minhas here. I'm here with my patient James, who was kind enough to be a model for this little video that we did. James, if you don't mind describing your initial symptoms when you first came in briefly.
Yeah, sure. So I came in with ankle and knee pain on my right leg.
Okay. So and this was going on for a little bit, I guess.
Yeah, for a few months. Okay.
One of the chief complaints that James was telling initially was that he had that knee and ankle pain more so at rest. It wasn't that classic activities every time I walk I do it. So is it true most of your symptoms were when you were sitting for too long?
Yeah, sitting or not using it for a long
period of time. Yeah. So I find if there's inactivity, so that, or if you're sitting for too long and you have pain which is kind of around the knee going down to the ankle, that's not a true representation of a pure joint issue. Ankle would hurt if with activity. If it was a pure ankle issue, it would hurt with stairs, walking, climbing all the time, or even simple ankle motions if he was just kind of inverting or everting. But this was more so at rest. And again, you did say you had some tingling or burning.
Yeah, in the kneecap, it felt cool and tingly. Yeah.
Right. So what we did was we did a bunch of McKenzie side glides. Do you mind just showing the exercise that you were just doing right now, the one next to the wall? Thank you.
This guy?
Yes.
Yeah. Okay.
So hand on the wall, and he did a bunch of side glides to the right side. He came in today with a pain of 5 out of 10 on his ankle, and he did a bunch of maybe about 3 or 4 sets of side glides to the right side, and seems like the ankle seems to be a little better. Perfect. Thanks a lot.